Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. If you're joining us live, we come to you every Saturday at 10:30 a.m. Central Time on YouTube, Facebook, X, and that's it. Also, if this is your first time checking us out, be sure to go to our website at UroPatient.com, where you can learn more about the show. Also, the best place to go and watch all of our past episodes. They're all up there. And we have these helpful handouts that you can download and take with you to your doctor's appointment or just have around the house for reminders. So this week we got a great show for you. I got the idea from a patient who wrote into me. He was going to have a test done in the office, and he was worried about whether he'd have to pee in public for it or could it be done in privacy. And he told me I suffer from shy bladder syndrome. And I'm like, wow, I really never did address shy bladder syndrome or paruresis before. So today, I'm going to talk to you about it. Today, we'll be discussing paruresis, commonly known as shy bladder syndrome. We'll cover its causes, effects, and ways to manage it. Let's get started. Shy bladder syndrome, also known as paruresis, is a social anxiety disorder that makes urinating in public restrooms or around others difficult. Paruresis is more common than you might think. It affects millions of people worldwide. It's a recognized condition, not just a personal quirk. So paruresis or shy bladder syndrome is a relatively common social anxiety disorder affecting approximately 7% of the population, with some studies suggesting that up to 20 million Americans experience it to some degree. So you're not alone. It is more frequently reported in men than women and often develops during adolescence and early adulthood. While many individuals experience mild symptoms, severe cases can significantly impact daily life, leading to social avoidance and travel restrictions. Despite its prevalence, paruresis remains underdiagnosed due to embarrassment and lack of awareness, though support groups and treatment options are available for those affected. So as I mentioned, paruresis isn't just in your head. It's primarily caused by a combination of psychological, physiological, and environmental factors. The most common trigger is social anxiety, where individuals fear being judged or overheard while urinating in public restrooms. Past traumatic experiences such as bullying, embarrassment, or strict toilet training in childhood can also contribute to the condition. On a psychological level, the autonomic nervous system plays a role when a person feels anxious. The body's fight or flight response can cause the urinary sphincter to tighten, making urination difficult. Additionally, environmental factors such as a crowded or noisy restroom can worsen symptoms. Over time, avoidance behavior reinforces the condition, making it more challenging to overcome. So paruresis can have a profound impact on somebody's daily life, affecting their physical, emotional, and social well-being. Physically, the inability to urinate in a public restroom can lead to urinary retention, discomfort, and an increased risk of urinary tract infections. Emotionally, it can cause anxiety, embarrassment, and low self-esteem, often reinforcing avoidance behaviors that make the condition worse. Socially, paruresis may limit a person's ability to travel. You're afraid you can't go if you're traveling in a public restroom. Attending social events. You don't want to go to the prom because maybe you're going to have to go to the bathroom and you can't go. Or engage in workplace activities that require public restroom use. Over time, this can lead to isolation, decreased quality of life, making proper management and support essential for those affected. Now, diagnosing paruresis primarily involves a clinical assessment by the healthcare provider, focusing on the patient's symptoms, medical history, and anxiety triggers. Since paruresis is a form of social anxiety disorder, a diagnosis is often based on self-reported difficulties urinating in public or around others, despite normal bladder functioning in private settings. Voiding tests may be conducted to rule out underlying medical conditions like urinary retention or prostate issues. And remember, I said this tends to come around the age of early adulthood and adolescence. Additionally, psychological assessments can help determine the severity of anxiety associated with urination. Because many individuals feel embarrassed to discuss their symptoms, Self-assessment tools and questionnaires can also be useful in identifying the condition and guiding treatment options. Each person responds differently to treatment, so a combination approach is often the best. Treatment for paruresis involves a combination of behavioral therapy, relaxation techniques, and in some cases, medications. Cognitive behavioral therapy helps patients challenge negative thoughts and reduce anxiety associated with urinating in public. Graduated exposure therapy gradually desensitizes individuals by practicing urination in increasingly challenging environments. Relaxation techniques such as taking deep breathing, mindfulness can help ease the body's natural fight or flight response. In more severe cases, medications like some anti-anxiety drugs or alpha blockers, which help to relax the prostate, may be prescribed to help relax the bladder muscles. Support groups such as the International Paruresis Association, it's a real thing, folks, also provide valuable resources for those seeking help. Simple changes can make a big difference in managing symptoms. So, some of the tricks you can do: find the restrooms in advance. Use things like background noise, running water, music, those ear things that everybody is wearing all the time. Put those in, play some music. Might be enough to get you to not focus so much on there being, other people in the bathroom. Practice this at home. That's the best way. Reduce anxiety through things like deep breathing. I've heard exercises where if you try to count backwards, because it takes your mind off of, so from 10 down to 1, 10, 9, 8. It's easy to count upward, but harder to count downward. And it makes your mind think. Sometimes that's enough to get you to relax. All these things can be helpful. Support and resources for managing paruresis are widely available and can greatly assist individuals in overcoming the challenges associated with shy bladder syndrome. Online forums such as the International Paruresis Association offer valuable information and supportive communities where individuals can share experiences and coping strategies. Additionally, therapists trained in cognitive behavior therapy or specialize in anxiety disorders can provide personalized treatment plans. Support groups, both in person and online, allow individuals to connect with others facing similar challenges, reducing feelings of isolation. Books, articles, self-help guides on paruresis offer practical advice, while mobile apps focus on stress reduction, relaxation techniques, and exposure therapy can further enhance progress. With these resources, individuals can find the tools and communities they need to manage and potentially overcome paruresis. So, folks, it's something you can fix. Don't live with it. So there you go. If you suffer from paruresis, don't worry. You're not alone. You can do something about it.